Medication-assisted treatment, MAT, your bridge back from the brink. Imagine addiction like a raging river pulling you under with its relentless current. You claw at the banks, desperate for something to hold on to, but the grip is slippery, the water icy cold. Medication-assisted treatment, MAT, is like a lifeline thrown across that river, a sturdy rope that can help you pull yourself back to shore. What is MAT? MAT isn't a magic cure, but it's a powerful tool in your recovery toolbox. It combines medication with therapy and support to manage cravings, ease withdrawal symptoms, and stabilize your brain chemistry. Think of it as a bridge connecting the tumultuous waters of addiction to the calm shores of recovery. How does it work? Different medications work in different ways, but they all share a common goal: to trick your brain into thinking it's already gotten its fix. Medications like methadone and buprenorphine act like opioids, occupying the same receptors, but without the high or the crash. Naltrexone, on the other hand, blocks those receptors altogether, making it harder to feel the effects of drugs. Why is MAT important? MAT is a game changer in addiction treatment. It can reduce cravings. Remember that desperate urge that claws at your insides? MAT can soothe that beast, making it easier to resist the siren song of relapse. Ease withdrawal. Detoxing is like riding a roller coaster in the dark, your body a mess of chills, sweats, and aches. MAT can dim the lights, making the ride smoother and less terrifying. Increased treatment success. Studies show that people in MAT programs are more likely to stay sober and rebuild their lives. It's like having the secret weapon in your arsenal. Save lives. Overdose is a tragic reality of addiction, but MAT can be a life raft, reducing the risk of that fatal plunge. But isn't it just replacing one drug with another? That's a common misconception. MAT medications are different. They're prescribed and monitored by doctors, and they don't produce the same intoxicating highs or crippling lows as street drugs. Think of it like taking insulin for diabetes. It's managing a chronic condition, not getting high. Is MAT right for everyone? Not everyone benefits from MAT, and that's okay. It's a personal decision, and you should talk to your doctor about what's right for you. But if you're struggling with addiction and feel like you're drowning, MAT could be the lifeline you need. Remember, you're not alone in this. Addiction is a disease, and like any disease, it's treatable. Reach out for help, explore your options, and consider MAT as a tool on your path to recovery. You can cross that river one step at a time. Frequently asked questions. 1. Is MAT addictive? No, MAT medications are not addictive in the same way as street drugs. They can cause dependence, but that's different from addiction. Think of it like needing glasses. You rely on them, but they don't control you. 2. Will I be on MAT forever? That depends on your individual needs and goals. Some people find long-term MAT helpful, while others gradually taper off with their doctor's guidance. 3. Is MAT expensive? Costs can vary depending on your insurance and the specific medication. However, many programs offer financial assistance, and the benefits of MAT often outweigh the costs. 4. Can I get MAT if I'm pregnant? Yes, MAT is safe and effective for pregnant women with opioid use disorder. It can significantly reduce the risk of miscarriage and stillbirth. 5. Where can I find MAT programs? Talk to your doctor or a mental health professional. You can also find resources online through organizations like SAMHSA, Substance Abuse and Mental Health Services Administration. Remember, addiction doesn't have to define you. Take the first step, reach for the lifeline, and start building your bridge back to recovery. You've got this.